This week, the nation marked Maternal Health Awareness Day, and this morning we want to dig deeper into a critical issue of maternal mortality and stillbirth. According to the CDC, there are 21,000 stillbirths in the U.S. every year. Nearly half of them can be preventable. Our advocates are pushing for action to address this crisis. Joining us this morning is Liz O'Donnell, Director of Education for the Push for Empowered Pregnancy. We appreciate you being with us.
Yeah, thank you so much for having me. I'm happy to be here.
Great to see you. And I know this is, it's such a sensitive topic to talk about, but it's important to talk about it, right? To kind of spread awareness and education. I know that this is personal for you. Do you mind just sharing a little bit of your story and how it kind of pushed you into advocacy?
Yeah, well, thank you for noting that, it is hard, but we have to talk about it in order to change it, right? And so my daughter, Aaliyah, was born still on December 1st, 2020, after a perfect pregnancy, or what I thought was a perfect pregnancy. I have learned so much since then that would have kept both her and honestly me a lot safer had I known about things like altered fetal movement, and just there's a lot of things that when you have a textbook pregnancy, you're not told and you don't know what you don't know. So that's why I'm here to share some info.
And we appreciate that. Talk about the reason that some of these stillbirths are so preventable and what do people need to know?
So there seems to be a lot of, I don't want to say misinformation, but misguided information on the internet. As a pregnant person, you want to arm yourself with all the education possible. And some of the things that we see on websites are simply outdated. For example, I'll use myself. I knew that reduced fetal movement and no movement was a problem. I had no idea that an increase in movement, despite me feeling just fine, could also be a sign of distress. The websites aren't telling you that. They're telling you to drink some juice, do some jumping jacks, and everything will be fine. And that's not a good measure of your baby's health or your own health.
Talk about exactly what you guys want to see when it comes to policy change, legislation, and kind of just education as a whole.
We want to call in organizations like ACOG and other professional orgs that really set the standards for prenatal care. Our international peers have done an amazing job at addressing fetal movement and at reducing their preventable stillbirth numbers, and we just aren't there yet. So we want organizations to join us in arming pregnant people to know they're normal, know your baby's patterns, use your mom intuition if you think something is wrong, and don't be scared to go to your provider. I always say to people, we are not here to scare anybody. This is what happened to us, and it is awful and tragic. We don't want that to happen to you. And the education is so important, but we need the people at the top to say how important that education is and to, kind of help change these misguided websites so that everybody can be safe and that moms and babies can make it home in a way that ours weren't able to.
Talk a little bit more about the education, the tools that are available that you guys are recommending for parents.
So fetal movement monitoring is so important. There are apps. If your phone isn't, capable for apps, there are things that you can print out to track movement. With Push, we have our campaign for knowing you're normal and using your mom voice. And so there, this misinformation of babies run out of room or, you just won't feel them closer to your due date. That is not correct. I know there's some, myth about 10 kicks in 2 hours. I won't even remember it because it's not important. Your baby has his or her own normal, and that's what you need to go with. So trusting your mom voice and knowing if you feel something a little bit different, it's okay to call. For me, I was worried about calling when I felt different movement because I didn't want to be an annoying mom. And we have to just dispel that myth and encourage pregnant people to use their voice and speak up if they think something's wrong.
And that is so important. Only have just a few seconds left. People wanting to get in touch with you guys, help out, how can they do so?
Pushpregnancy.org. We are at Push Pregnancy. We have all types of information for anybody that's pregnant, especially for those pregnant after loss.
All right, Liz, thank you so much. We really appreciate it.
Thanks for having me.